Okay, good morning, Mr. Bryce. I'm going to be teaching you about your postpartum discharge teaching.
Okay.
So the first thing is going to be diet. This is for you. You want to make sure that you maintain adequate nutrition so your body can heal. So you should eat foods high in fiber. That includes bran, broccoli, cauliflower, fruits. That'll help your bowel movement become regular. You also want to eat foods rich in calcium, which include dark green leafy vegetables, milk, and yogurt. Make sure you drink plenty of water and non-sugar supplemented juices each day. This will satisfy your thirst and maintain your hydration. You want to avoid soft drinks, coffee, tea, and alcoholic beverages. As far as your activity goes, you can gradually increase your daily activities until you're back to your normal routine, and make sure you rest frequently. No lifting, pushing, or pulling for the first 2 to 6 weeks or as instructed by your physician. Do not drive until you are released by your physician.
So, you have to wait until you go back and they approve you to drive?
Yes. As far as breast care, your breasts and nipples will change and grow in size as they probably did throughout your pregnancy. So you want to make sure that you wear a fitted, supportive bra day and night, which will be more comfortable as your body adjusts to these changes. You can wear breast pads until they stop leaking. This leakage may occur for several weeks to months. And if you experience discomfort, you can place ice packs in between feeding. If you were not breastfeeding, I would still wear a well-fitted supportive bra for 2 to 3 days following delivery, and refrain from stimulating the breasts and nipples. Do not pump breast milk or permit the newborn to suckle to alleviate engorgement. Make sure you apply cold presses in the form of a frozen wet towel, cold packs, or ice packs for 15 minutes at a time every hour as needed. To prevent tissue injury, don't apply it directly to bare skin, and do not massage or apply heat to your breast. Are you breastfeeding?
Yeah.
Some tips for that is your baby's mouth should form a tight seal. The lip should be against the areola, not the nipple. If the baby is suckling incorrectly, slide a finger between your baby's lips and your breast to break the suction gently, and then reposition and try again. You should nurse as long as your baby wants, which is usually 10 to 30 minutes. At first, your newborn will probably want to nurse many times in the 24-hour period, though not for long. It is important that the health of your breasts stay good to have your infant feed from both breasts every feeding. Good signs of nursing is hearing your baby swallow without a clicking sound, seeing movement above the baby's ears like a little wiggle, not seeing dimples in your baby's cheeks. You and the baby should be calm and relaxed during the feeding. You'll feel gentle tugging at the nipple, but there should not be pain after the first few minutes. If you do feel pain, it may mean the baby is not positioned properly or that the tongue does not extend past lower jaw. Remove the baby and begin again. As far as hygiene goes, make sure you wash your hands frequently as you're caring for yourself, and to prevent infection, always wipe from front to back, going to the toilet, and clean your bottom with warm tap water using the Perry bottle, which we'll give you, after you urinate or have a bowel movement. Make sure you change your pad frequently. Vaginal flow should decrease in amount in color from bright red to pinkish or brown to yellow or cream. Your menstrual period may occur as early as 6 weeks to 2 months after the birth of your baby. Avoid constipation. You may take a mild laxative or stool softener until bowel movements have returned to normal pattern. Increase fluid and fiber in your diet to help with this. This next part's really important. Birth control. Discuss birth control options with your provider. You may choose to obtain a method of birth control before resuming sexual intercourse. Nothing should go into the vagina the first 6 weeks after discharge. Sexual intercourse should be avoided until bleeding has stopped and you feel physically and emotionally ready. You need to report these signs to your healthcare provider immediately. Pain, redness, warmth, swelling, drainage, foul-smelling discharge from the incision, or if the incision begins to open as far as your laceration, or if you had a C-section incision. Discharge from the vagina that has a bad odor, severe headaches or blurred vision, temps over 104, or if you feel cold, feverish, or experience chills. thoughts of harming yourself or the baby, pain or burning sensation, redness, warmth, or swelling in the legs, breasts that are painful, swollen, hot, tight, itchy, or have sores with redness or red streaks and flu-like symptoms, sharp pain in your abdomen, breast, or chest, trouble breathing, dizziness or faintness, crying spells or mood swings that you feel you cannot control, if you're unable to empty your bladder or if urinating is painful and difficult or it becomes too frequent, and if you have difficulty having a bowel movement.
Okay.
To report any domestic violence or abuse, please call 1-800-96-ABUSE. As far as the infant goes, I'm going to talk about some safety. When sleeping, place your infant on his or her back. Use sleep clothing such as a one-piece sleeper instead of a blanket. Do not let anyone smoke around your infant. Use a firm mattress and a safety-approved crib covered by a fitted sheet. Car seats and other seating devices are not recommended for routine sleep. Do not use pillows, blankets, or pillow-like bumpers in your infant's sleep area. Wedges and positioners should not be used. Make sure you keep soft objects, stuffed toys, and loose bedding out of the infant's sleep area. The baby should sleep in the same room as you, but not in the same bed. Avoid covering the infant's head or overheating. The bulb syringe can be kept near the infant at all times to clear the infant's throat or nose if necessary. Clean it well with warm soapy water after each use and allow to air dry. And wash your hands prior to handling the neonate, along with anyone who's going to handle the baby. All infants are required by law to be in a car seat while the car is in motion. Children should be placed in a safety seat according to the state laws. The use of outdoor announcements is not recommended to announce the birth because they call attention to the presence of a new infant at home. Question any unfamiliar persons visiting your home or inquiring about your baby after discharge. Do not use home monitors or commercial devices marketed to reduce the risk of SIDS. As far as behavior goes, crying is a normal response for your infant. The most likely causes for crying are hunger, need for a diaper change, or needing to burp. You should burp your baby after each feed. To calm your infant, you can rub its back, change its diaper, feed the infant, rub its belly, walk with your infant, rock it, skin-to-skin contact, or give the baby a pacifier. Do not shake your infant. If you get frustrated or angry, put it in a safe place, take a break, call your spouse, or call a friend. Sleep patterns, they require a lot of sleep. You should be waking your baby at least every 3 to 4 hours for feeding. They will most likely be asleep and you will have to wake them up. You should place your baby on his or her tummy each day for supervised tummy time. This will help strengthen the neck and abdomen. You should breastfeed your infant 8 to 10 times per day per infant cues. Be sure to hold your infant close to you while feeding. It needs to be cuddled and skin-to-skin time is recommended. After feeding, hold your infant upright over your shoulder while gently patting or rubbing his back to make sure they burp. If you are going to formula feed, your neonate is receiving a Similac or Enfamil diet. If your baby sleeps longer than 4 to 5 hours and misses feedings, awaken your baby. It will generally take 2 to 3 ounces per feeding after the first few days of life and will need to eat every 3 to 4 hours. Make sure to hold your infant close to you while you do feed. Your infant needs to be cuddled even if you're formula feeding. And infants also need to be burped after every ½ ounce of formula. So after feeding a ½ ounce, hold your infant over your shoulder and gently pat or rub its back to burp. If your newborn experiences a rash, it is normal. It appears with small red circular areas and a white dot in the middle. This one does not require treatment and will generally resolve within the first week of life. Avoid any lotions, powders, or perfumes. Mylia are white pearly bumps, usually on the face, especially around the nose. They'll disappear within the first week of life. Jaundice is common in newborns. Your infant may appear to have a yellow coloring on his or her skin. It will start in the face and progress down to the toes. If your infant appears more yellow in the next 24 hours, call your healthcare provider immediately. You'll need to bathe your infant in a sponge bath until the umbilical cord falls off. Using a soft washcloth with plain water, gently wash your infant's face. Bathe your infant from head to toe, saving the diaper area for last. Mild infant soap may be used on the infant's body. Keep the umbilical cord clean and dry. Cleanse with warm water and soap when soiled. Inspect the cord and surrounding skin with diaper changes, and notify the physician if drainage or discoloration is noted. The umbilical cord will generally fall off within 2 weeks of life. Wet and dirty diapers. 1 to 2 wet diapers are normal for the first 2 days of life. Days 3 and 4 should have 3. Then you should expect to have 6 to 8 diapers. So 1 and 1, 2 and 2, 3 and 3. Over the next few days, your infant's bowel movements will begin to change from a yellow-green to a mustard yellow and will soften in consistency. Your infant should have at least one bowel movement every 24 hours. You may want to keep a record of your infant's wet and dirty diapers to monitor adequate elimination and hydration. For female genitalia, always wipe baby from front to back. Be sure to cleanse all creases and folds to prevent any diaper rash. Pat dry and then diaper. It is normal for baby girls to have a white or pinkish discharge. These secretions are normal and will gradually disappear. If your male is uncircumcised, always wipe the baby from front to back and be sure to cleanse all creases and folds to prevent diaper rash. Pat dry and diaper. If your male is circumcised, always wipe the baby from front to back. Be sure to cleanse all creases and folds. Pat dry and diaper. Vaseline gauze is applied to the circumcision with every diaper change for approximately 24 hours. The head of the penis will appear red initially and then will change to have a yellowish, sticky film. This is normal. If you see any bright red bleeding or green drainage, you should contact your healthcare provider. The plastic ring method of circumcision does not require dressing. The ring that is used will come off usually by 2 weeks. If you notice swelling, bright red bleeding, or green discharge, you should contact your healthcare provider. To cleanse the area, wipe gently with a soft cloth, cotton swab, or gauze pad in plain water. Make sure you dress your infant as you would yourself. Avoid overdressing the infant because too much clothing and too many blankets may cause your baby to become overheated. And infants should receive all recommended vaccines. Do you have any questions?
No, I think you did pretty good.
Okay, I'll give you this discharge teaching paperwork to make sure you have all the information. And if you have any questions, make sure you let me know before you leave.
Awesome, thank you.